Hello and welcome to today's episode on life-saving aid. Today we are going to be looking at what to do in the event of a stab wound to the abdomen, the part of the body where people commonly refer to as the tummy or the stomach. This is a typical example of a situation whereby someone has been stabbed by a knife at the abdomen. What do you do as the rescuer? First and foremost, before you approach the victim, ensure that the environment is safe. The reason is because you as the rescuer must ensure that you are safe at all time, because we don't want to have two victims on the ground. So ensure that you're safe. When you're safe and you come across someone who has been stabbed on the abdomen or on the tummy with a knife, what do? You quickly assist the person to lay on their back. This particular knife, please and please do not remove it. We want to quickly just show you why you should not remove this knife in the event of a stab wound to the abdomen where the knife is still within the abdominal wall. In the event of a stab wound to the abdomen like this, okay, you see that already the victim is bleeding. And this knife is helping you to reduce the bleeding. So in a situation whereby someone is being stabbed with a knife on the abdominal wall, please and please don't take out the knife. Taking out the knife is going to worsen the situation of the victim. What do? You stabilize. This knife should only be taken out at the hospital. If you take out the knife, this is what happens. You see the increase in blood flow. And before you know it, this victim is going to bleed out. So please and please don't take out the knife. When you take out the knife and then you come across a video like this where they say don't take out the knife, please and please don't go and try to put the knife back. You'll be creating more injury. Now that we understand why we should not take out this knife, in the situation whereby the knife is still within the abdominal wall, what do we do then in order to help this victim? Because we are going to be coming in contact directly with blood, what do? You get a glove. Okay, if you don't have a glove, look for a clean nylon bag that you can put your hand before you do what you want to do, except if you are sure of the retroviral status of this victim and the hepatitis B status of this victim. But even as at that, it is best you maintain universal precaution. Put on your gloves, quickly get 2 clean cloths or 2 towels, and you place on the side of the stab wound like this. You place on the side of the stab wound like this. You are not taking it out, okay? And then you apply pressure. After stabilizing the knife on the abdominal wall with 2 clean cloths or 2 clean towels, remember that at the same time you're also trying to reduce bleeding. And how do you reduce bleeding? You apply pressure. So with this, we pass another set of cloths behind from the back towards the front of the abdomen. So these are 2 cloths. What are we going to be doing with this? We'll be tying this in order to kind of make it look as if you're applying pressure on the abdominal wall. Make plans to rush the victim to the hospital. If you are in an environment where emergency medical services exist, you activate emergency medical services, you call an ambulance, call for help, okay? If you are in an environment where emergency medical services is not available, what do? You start making plans for means of transportation, call for help. Abdomen, call driver, please help me call driver. We need to move this victim to the hospital. While they are helping you to get the driver, okay, you secure this in front, okay? Avoid touching or moving the knife. Okay, when you apply these 2 things in front like this, avoid the knife. Okay, you tie in order to apply pressure. Please remember that you must, as the rescuer, also remain calm, because if you are not calm, most times you'll be the one to knock off the knife and worsen the situation of the victim. So also, while you are doing that, the victim is not unconscious. It means the victim is conscious. So while you are doing that, you are telling the victim, don't worry, help is on the way. Because if the victim is agitated and anxious, the heart rate will shoot up. It will increase blood flow to the site of the injury, thereby worsening the bleeding. So you must continue to reassure the victim to remain calm. This way, heart rate is stabilized or reduced, and then the rate of bleeding is reduced. Now, with this in place, you see that you can safely transport this victim to the hospital. Please and please, you are not trying to treat at the scene of the accident. What you're trying to do is to stabilize this victim in such a way that bleeding is reduced while the knife is still retained, because the knife is also assisting in reducing bleeding. You saw the video we showed earlier, how we demonstrated if you take out the knife, you are going to worsen the bleeding and this victim might die before you get to the hospital. And then when the knife mistakenly falls off, please and please don't try to put the knife back inside. No. What you do, if the knife is out of the place, just get your clean towel and pack it and tie in this manner while you move the victim to the hospital. You assist the victim to fold their knees upward. This way it helps increase blood flow back to the heart. Keep reassuring the victim. Help is on the way. We are on the way to the hospital. Now, in situation whereby you realize that this victim is no longer responsive, you've done all this, hello, 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 help is on the way. The victim is no longer responsive. You check the carotid pulse, where at the junction between the lower line of the jaw and the neck, you press, there's no pulse. It's not just bleeding again from the abdomen. You quickly switch to chest compression because this victim is unresponsive. It means that this victim has sustained cardiac arrest from the extreme bleeding. Okay, so you clench your fist, you locate the middle of the chest, and you start giving your chest compressions 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. While you are doing all this, please and please make your way to the hospital. So it means that even when this victim is in the vehicle where you are transported to the hospital, you are giving a chest compression until the victim either becomes responsive or you get to the hospital. In a situation whereby the victim is conversational, is responsive, then there is no need for chest compression. Therefore, doing all this will help increase the chances of survival of this victim. I hope this video helps someone out there. Please share this video so that together we can help save more lives.